Caroline, thank you so much for joining me today. Really excited to deep dive on a lot of things third sector is doing, a little bit about your journey up to this point, and then sort of the organization's overall, mission and vision and what that looks like, for the future and what you're doing inside of communities across America right now. So before we kind of get into third sector, talk a little bit about your journey, your sort of career arc, before third sector.
Thanks, Grant. It's exciting to be here and share a little bit about third sector and me. For my journey, when I was graduating from school, I was wanted to work at the intersection of business and social impact. And so I found myself actually as an AmeriCorps member supporting
Mm,
nonprofits that were looking to grow.
yeah,
Now, as you may know, it's pretty hard for nonprofits to grow. They're a little bit on a fundraising treadmill, it feels like
yeah.
every year, and it's hard to grow and scale. And what we found out doing that work is that you really have three choices when you're a nonprofit. You can sell something, fee for service, you can go after philanthropy, or you can go after government funding. And what we found was that some of the nonprofits that were the most responsive, most impactful in their communities, they might have had separate studies showing their impact. None of them wanted to work with government. I started asking why. Why is that? And really, it was because they said, it's too much compliance. It's too hard to get those contracts. At the end of the day, government can't tell the difference between a nonprofit that provides services and one that provides results. And we heard that enough times from deeply impactful nonprofits that my co-founder and I thought, well, what would it take? What would it take to get government in the business of paying for results? What if our government spends over $1 trillion a year on social programs? What would it take to get them
Mm.
in the game of funding social impact in a different way? And how much could we move the needle? Better outcomes for everyone in this country if government was seen as an important partner and player in the social impact space.
Looking at those different aspects of the sector, let's say, and just your background, what was the light bulb moment or the catalyst, for really, creating an organization that would sort of solve for this? It's really, we always have ideas and we think about certain things, but then really pressing the button on go and starting something and dedicating a lot of your life, to building something is a pretty big deal and a pretty big moment in a person's, life. So I guess what was the real catalyst and spark for saying, okay, we see an issue, we think we can solve it, let's start something and dedicate a lot of our, time and life to it.
Yeah, it's a great question. So it really took several years for us to pull the trigger on this because we had been working with nonprofits and then got curious about the role that government could play as a partner. And so we started asking around. We started asking around to state and local officials, and most folks thought we were crazy at first. And so we kept staying in the work in the nonprofit sector, trying to build sustainability models for impactful nonprofits. And then it wasn't really until we had a willing partner from the government. It was the state of Massachusetts that said, you know what? We're curious. Could we think about allocating our funding and doing really a new procurement, a new type of RFP that's more about
Mm.
results than it is about services? And when we had that willing partner, that was when my co-founder George and I looked at each other and we said, okay, like we're ready to take the leap. We're ready to work with nonprofits to try and meet this goal, to support the state in that, and to see if this idea could turn into a project in Massachusetts.
Even
And then to see if that project could come and inspire other governments across the country. So that was really, it was a slow burn, honestly, conversation around saying, is there demand for this in government? Are there willing partners? And then once we got that willing partner, we jumped in to help transform those relationships and collaboration between Massachusetts and their nonprofits.
what was that pitch to them? Do you remember what it was like, what that was, and maybe why they, agreed to it?
Yeah, it's a great question. So The programs, the pitch was to a different government person than you would have thought.
Okay.
So a lot of times our work in nonprofits and the programs we were working with were in homelessness and juvenile justice.
Mhm.
The government partner we found was actually in the budget office, the head of finance and administration. And so the pitch to him was about you're spending hundreds of millions of dollars a year on homelessness services or justice services. And reincarceration rates are going up, or homelessness rates are going up. Like something's not working, right? You're putting
Mhm.
lots of money at the problem, or good money after bad, and things aren't changing. So rather than taking a siloed approach, like within each of those government agencies, right? Department of Homeless Services deals with homelessness, Department of Corrections deals with justice. The pitch to the budget office was you have a unique power and role to be able to look across agencies and to inspire nonprofits to do not just the letter of the services and homeless services or the letter of
Mhm.
services and juvenile justice, but to do what it takes in order to achieve a particular result or outcome goal, in order to reduce recidivism, in order to increase amounts to use stable housing. And so the pitch to the budget guy was you could actually do more and do better with your public funding if you were to initiate a results-based contract from where you sit in the budget office versus having to be siloed in one agency. And that was something pretty new
Mm.
and pretty inspiring, I think, for a guy who got to see all of the receipts and how much is being spent. I was starting
Right.
to learn just how suboptimal those results were. So he was able to make a call as sort of the boss of these other agencies to say we're going to try something different. We're going to try something based on results. So yeah, that was the pitch, and how we got that first willing partner, which has since grown to my goodness over 60 of our government partners that we've worked with over the years.
That's a great segue because let's talk about, third sector, overall, its sort of mission and vision and where it sort of sits in this sort of ecosystem of, let's say, impact, but results. The results ecosystem. Where does third sector sit? And talk a little bit just about the overview and sort of the mission and vision.
Yeah, so similar to how I started my career, third sector sits at the intersection of government and communities and really serves as a bridge to help inspire collaboration and transform relationships and create new possibilities for change and outcomes. So where we sit specifically, we're structured as a nonprofit, but
Hmm.
we exclusively exist to support our government at a federal level, the state level, the local level, to help transform how they are delivering responsive services in communities, how they're partnering with nonprofits and collaborating, how they are collecting data, how they are using data to make
Right.
choices about how to use our taxpayer dollars in the most responsive ways. How our civil servants in government, we really provide technical assistance and capacity building to help those working in our government to build the skills of stakeholder engagement, of data analysis, and of the ability to build contracts that are more about learning and improvement to get to results than they are about inputs and outputs in particular services. So that's where we sit in the ecosystem, but we certainly cannot do our work without deep collaboration with those nonprofits that are delivering direct services on the ground and partnering with government and philanthropy in many cases in order to make that those outcomes a reality.
I love taking like, examples or case studies. You mentioned sort of the first one in Massachusetts. Can you give us like maybe an overall, case study, a practice area, data, coming from that, maybe just an overall approach, and a case study, like something that has really worked, right? You took a practice area, whether that's education, diversion, health, and you looked at it, tried to understand it a bit better, looked at the data that these government entities have and sort of the nonprofits have, and creating a real roadmap for, some impact and sort of results. Do you have a
Thank you
favorite?
for that question. So, and thanks for naming some of the areas where we work to grant. So, we have been around for over a decade at this point at Third Sector, and we have evolved to prioritize four main practice areas: behavioral health, economic mobility, childcare and early education, and diversion reentry. And we focused on those areas truly being responsive to our communities, as these are areas where our government spends an incredible amount
Mm,
of resources and taxpayer dollars and
yeah,
is really struggling to get good results. So there's other opportunities in infrastructure and
sure.
roads, but we're focusing on the human services and the people
Yeah.
outcomes side. And so a
These are very
specific
foundational to
right.
society. Yeah.
They're foundational, and what's interesting is while they're different practice areas, we've found increasingly that we are working across those, across
Mm,
behavioral health and
yeah.
diversion and reentry, across early childhood and workforce, right? They're not because people, humans, we all as constituents, we experience our government in silos, right?
Mhm.
When
Right.
actually our needs are not siloed, like we're whole people. So we have these practice areas because we found the need to both meet government where it's at, get in their silos, but also encourage them, to be able to see the whole people and their whole constituents that they're working with. So that's overall about practice areas. They offer a specific example, and I'd love to give you one in childcare and early childhood because I think it really illustrates how data is a huge part of our work, and then just the possibilities when you take more of an outcomes focused approach within our government. So for early childhood, this is actually in Massachusetts as well and some other states, but if we think back to the pandemic lockdown, our nation had a real crisis around childcare and early childcare education and development. So
Mm,
parents were struggling to figure out how to work from home and then show their kids also getting early learning and development. And so the federal government responded with a lot of American Rescue Plan dollars in funding for childcare. But in those funds, hundreds of millions went down to every state. And it was left to the states and in our federalist system to really decide how best to deploy those dollars in a pretty short amount of time that the feds gave,
mhm. Yeah.
and to do it in a way that would help the most vulnerable young children in our communities to thrive. And so that was the challenge that early childhood faced, right? That was being put to our country in the pandemic. Now, third sector, we worked with four states, so Massachusetts, Connecticut, Louisiana, and Maryland, to help those states. A lot of times when states get money from the feds, it's like, okay, let's just put it out as quickly as possible and do more of the
Right.
same. Get it out onto the streets. These four states really wanted to take a step back and develop a funding formula that would more equitably distribute those dollars and ensure that all of the young children in their state, no matter their race, their background, or circumstance, and the providers across their state, no matter which community they were from, had what they needed to stay open, which was huge, and to
Yeah.
stay providing good services. And so, what Third Sector did was we helped do a data analysis with each of those states using the Center for Disease Control Social Vulnerability Index, which has, it
Hmm.
goes by zip code and it actually tells you how it gives a vulnerability score for a community based on a number of factors, whether that's education levels, whether that's transportation access,
What's it
housing,
called? The social what score?
social vulnerability index. I can share the link with you after.
I
It's a
see it.
huge, it's national, publicly available data set.
Yeah.
So we use that and apply that across these four states to help those state governments identify where in their state were actually the areas of greatest need. And then we help them say, okay, based on the areas of greatest need, can you develop a funding formula using these federal funds that gives bonuses based on different demographic or provider characteristics to ensure that the entire service delivery system of child care not only survived during COVID, which was actually a question, right? A lot of places, a lot of child care centers were closing down, but they were on a path to thriving. And so to kind of close that up, the results in Massachusetts was after doing this analysis, the state of Massachusetts distributed about $600 million over the course of the pandemic to almost 6,700 providers of childcare across Massachusetts communities. They were able to do so in a way that was different from the past, using benefits of vulnerability index. They shifted how much money each program got, and just shifted how they were paid. They started paying per slot versus paying for, each child showing up, because in COVID, that was pretty hard to plan around.
Sure.
But it really resulted in sustaining access to quality programs for more than 175,000 children in Massachusetts. So our support to really help our government in Massachusetts analyze their communities, understand more deeply the needs of their communities using the social vulnerability index, and then help them translate that into, okay, what would this mean for how we distribute our funding? And then how does that meet these providers? Our work really helped them to keep those providers' doors open, keep critical care workers employed, and most importantly, keep our young kids in quality early learning programs.
I want to kind of double click on just data for a second, across these sort of practice areas. And, we're kind of at like, sort of a data renaissance and, sort of the golden age of of data. And government has a lot of it. It seems like they have, an amazing amount of data. Is data the biggest tool in sort of this toolkit for possible better outcomes? Let's say 20, 30 years ago, we had data, but maybe not as robust data, and we certainly didn't have the technology to visualize the data as good as we have now, to understand it a bit more, to share it maybe across policymakers, across nonprofits in each one of these practice areas. How is data sort of maybe transformed or can transform all these different areas to improve results, quite significantly?
It is a great question. And I will say the short answer is data has already transformed and still can transform our government's ability to be more responsive in our communities. And so really, the work that we did with Massachusetts in early childhood care probably couldn't have been done 20, 30 years
Right.
ago, right? Like there was no social vulnerability index 20, 30 years ago. The presence of data within agencies has really enabled a lot of our work, which is to help our governments be more responsive. And in order to be responsive, you need to know what's going on, right?
Hmm.
Like
Yeah.
if you want to be responsive and update your service delivery, you need to collect and analyze data constantly, right? Because every change or improvement that you make to the agency is going to need to be analyzed to make sure you're hitting your goals, right? And to
Mhm.
improve or refine or keep meeting those goals over time. So, truly, advances in data collection and visualization have been essential to third sector's work and to our government moving closer to be more responsive and learning and improving on the work that they deliver. And it's just been helpful also, honestly, to make the case that government needs to do differently, right?
Mhm.
Because the data, again, I go back to like, why did someone in Massachusetts want to work with us in the first place? It's because they could see with data that they're spending hundreds of millions of
Right.
dollars to solve homelessness, and they're seeing it get worse from the accounts.
Right.
But,
Right.
all those things that, helps build a case both at a macro level. And then if you double click on the data and you can see oftentimes programs do work. They work for a small amount of people.
Right.
But with the improvements in data, we're able to see which programs are working for whom and in what context. And that is really important information for government too, to go back and think about, okay, how do I, these folks are doing great and that's awesome. How do I better serve these other groups or these other constituents they have that are not hitting the same outcome goals? What opportunities do they have that they need to do better? So that's how I think data has helped transform the possibilities of government becoming outcomes focused and investing in responsive services. That said, I think there's a long way to go. As I
Mm,
mentioned, government continues to be pretty siloed, and there is a culture of compliance driven that the data that is collected often stays only within the homelessness system, for example.
yeah,
And
yeah,
in reality, people who are experiencing homelessness may also be experiencing a correction system. They may also be
totally.
experiencing the medical system. And so, sort of the
1,000%, yeah.
next frontier that we're working on with our governments is how you break down the silos between agencies. The
That was my
data
next
silos.
question. The
Yeah,
exact
how do you break
question
down the
is
data silos? Because, again, remaining the case, like, because you now know people who experience homelessness are also interacting with all these other systems,
yeah.
how can we work to overcome the legal and governance barriers? And it's really more legal and governance barriers than it is technical at this point to combine that data and give a more full picture of what's going on in our communities so governments can better respond.
Is that would that be at the federal level or the state level that movement is possible on that? Would it be easy
Yeah.
to go to Massachusetts and be like, "Hey, let's make you sort of go back to, Massachusetts where it all began, but like a beacon of data, infrastructure sharing layers across, all these practice areas, all your departments." Would it be easier to enact at a state level rather than a federal level? Had you had conversations with
Yeah.
policymakers around this, and what's sort of their feedback on it?
It's a great question. I will say that there is incredible power at the state level to do this data integration work.
Mm,
I will
great.
also say that, like, you don't need the feds to combine all the data at the federal level. No. But what does exist in our governments right now is a fear that it's not allowed to do that. And
Hmm,
where the feds can be really helpful, federal agencies like the Department of Labor, Education, or Justice is in providing the guidance. And it doesn't need to be new legislation or anything, but the guidance and the encouragement, and in some cases, honestly, funding, because it does cost money to integrate these systems,
sure.
right? To be able to integrate data across different siloed agencies. But we have seen, talking about Massachusetts, we do a lot of work in Kentucky. KY, they have an amazing program called KY Stats, which has
Hmm,
integrated data, sort of cradle to career across multiple agencies. And they've done that at the state level. It takes investment and commitment to do that and a willingness to push the what you can do versus assuming that you can't do something because it
yeah,
hasn't been done before. But there's been incredible leadership out of Kentucky. California also has a strong investment in their cradle to career data system. So it is possible at a state level without new federal legislation. And there's a lot of, history to overcome, or traditions, if you will, or preferences for folks.
yeah,
It may not be legally allowed. And so we spend a lot of our time at Third Sector, affectionately, as we call it, myth busting around what
yeah.
is actually like word of the law and where the possibilities for interpretation and really improvements in collaboration across agencies, both with their data so they understand what's going on, but also in terms of their programming and how they're serving constituents in order to get to improved outcomes versus just kind of delivering services through their single agency because that's how it's been done before.
I can see the issue around the health side, I guess. I guess there's some
Yes, it
issue,
is real.
that would be sort of the one bottleneck I see as far as that data being shared with, the education data or the justice system data. Although it's a big, part of it, because maybe if you grew up with mental health issues, then that's gonna impact your education. You're gonna perhaps end up into the justice system, and so that is valuable health. But historically, health data has been the one big thing that has been sort of on lockdown, let's say, and not able to share it across really anything but your doctor, right? And that's probably hard to get around that. But these other ones, there seems to be perhaps an opening. Early education and the justice system, I think there's so much data there, and I think there's a lot that we can divulge from data that comes from that system. If we could double click maybe on that practice area a bit more, what have you learned about that area or sector, and what how have you seen data maybe play a positive role in assessing, an issue that every state, frankly, deals with, whether it's, homelessness could lead to justice system or vice versa. Those sort of play probably hand in hand with each other. What is, you know, you and the team's experience been double clicking on that sector, and what are maybe some positives that have come from the data research in that area, and maybe what are some difficulties that are still faced there?
Yeah, great question. So, in the justice area, and we have learned, I'll just say globally, like we have learned, we don't have a homelessness practice area or a diversion or reentry practice area. Because one of the big insights we've seen, both from the data and just our experience partnering with governments, is that homelessness and
Mhm.
those that are either those that are returning from incarceration is there's a very strong overlap there,
Yeah.
particularly for that group of individuals. And in fact, while we have siloed agencies for reentry, what we are finding is that they focus so much on stopping reoffending, but they do not focus on what does this person need in order to thrive
Mhm.
and re-enter society. Honestly, homelessness can be as high as 50% for a lot of these individuals that are returning from incarceration.
Wow.
So do they have a place to live? Do they have behavioral health support? Do they have pathways to employment? So much of the data that we've been able to bring and share to departments of corrections, oftentimes at the county level where they're administered, is
Mhm.
just an understanding of, you're tracking recidivism rates. What is actually going on with these people, with these individuals that are going back, right? How many of them have a safe place to live? How many of them have behavioral health needs? And so that data has actually been incredibly helpful for our departments of corrections to start to honestly build projects that are outside of the norm for correction systems. So I think about
Hey.
some of our partners in Pennsylvania state, they were looking at, again, their goals are to prevent recidivism and get people out of the correction system when it is their time. They were looking and realizing through the data that several folks that they had that were older or had developmental disabilities could not be released to the community because they had nowhere to live. And so they
Sure.
were remaining incarcerated. And they were like, what do we? Well, it's clear that the barrier here is that they don't have stable housing. So
Mhm.
what would it look like? And third sector, we partnered with them to go out into the community, understand the nonprofit housing supportive services ecosystem a bit more, and help them build confidence that they, the Department of Corrections, could initiate a request for proposals for housing services for their population. And so for the first time, rather than paying for parole officers or what have you, mine were those folks, they said, hey, we're interested in investing in supportive housing providers that are going to help our particular population of interest reintegrate and achieve stable housing upon returning from incarceration. I'd say what's been most exciting, one of the things that's been most exciting for us in our partnership with correction systems and our women is to help them understand, again, move from this sort of incarceration or keep them out approach or surveillance approach
Mhm.
to one that is like, how can we help invest in thriving for these individuals? And we've been getting them in the business of better collaboration and partnership with housing, better partnership with behavioral health, better partnership with good jobs providers, not just, did you show up, check the box to any job, but are you actually being trained and supported in a career that can earn a living wage? Right. And so that's been super exciting to see from that practice area. And that has involved, to get back to our original point, a lot of the both sharing of data and understanding, whether it's community data and others from like homelessness workforce and behavioral health systems, just helping honestly to educate and provide a more nuanced picture for folks in the Department of Corrections about who their population is, what their needs are, and how they can achieve their goals as a department, right?
Yeah.
Of reducing those that are incarcerated by actually investing in the thriving of those individuals with their housing, employment, and behavioral health needs.
I'll end on a few questions here, and this one's sort of a piggyback off that. And has there been work with private prisons around data? Do they work with governments as well to provide some type of data around, you know, their constituents, let's say, that are in and out? Have you had any contact with them or partnership with them that has been positive, that they have worked to help with some of these problems in, let's say, Pennsylvania or Massachusetts, wherever you've worked before? Has there been any contact with them at all?
So every correction system is different across the country
Mhm.
in all of our states and
Sure.
communities, and it can
Yeah.
be a combination of publicly run or privately run. While we haven't had direct contact with the private prison system, a lot of what we do at Third Sector is help our government understand either how can they be more responsive with their government-run services, and
Gotcha.
how can they also be more responsive with the services they contract out, right? And how can they get
Mhm.
better outcomes if they're doing a contracted
Right.
services? So whether you're a private prison or a nonprofit, service provider, government contracts out billions of dollars, right?
Yes. Yes.
Every year to folks. And what we have learned is that there really is value in bringing an outcomes focused approach to those contracts. So whether in justice or across all of our practice areas, we believe that an outcomes focused approach to contracting starts with like, what is the North Star? What are you actually trying to achieve?
Yeah.
And so in for some of our corrections agencies, it's always reducing and rates of recidivism is a big outcome.
Sure.
What we encourage or, with our use of data, open up the possibility for is could you ask for a different outcome? Could you ask for stable housing? Could you ask
Mm,
for
mhm.
employment as part of your contract
Right.
with external parties? And that sort of shifts the conversation from business as usual to more
Yeah.
towards what would it take to be more responsive to get those outcomes that you really want. And so, in the case of Pennsylvania, we're again working with nonprofit housing providers. Their goals were around stable housing
Mm, mhm.
and connections to behavioral health services and connections to employment. They are also measuring recidivism rates
Yep.
100%,
Yep.
right? But part of those havens and part of the goal is to really shift the intervention, if you will,
Yep.
to be more focused on achieving those part. So I think there are a lot of possibilities for conversation, for collaboration around first, what are the outcomes that we want our vendors essentially to
Yeah.
achieve? How do we build those outcome goals and those metrics with those that are impacted, those that have been incarcerated, service providers in this space? And then how do we use data in an ongoing way to measure and learn how we're doing on those metrics and outcomes that we set. And we think, not Tucker to say, we think that building all of that into a contract is essential because a
Yeah.
contract is
Totally.
just it's a relationship, right? Like you're just outlining the bounds of the relationship and you create incentives in those contracts all the time.
Yep.
And so why not create incentives to deliver more responsive services and get better outcomes?
Interesting. Yeah, the contract part of this is probably something else that could be, deep dove into all these contracts and look at that data and then see how even these contracts can be improved. Uh, just from a foundational level, if you input certain outcome metrics in there or successes, maybe that triggers, certain funding layers, to where it's not maybe just one outcome, but it's several that need to be attained.
Mhm.
Because it is our money, right? As our taxpayers, it's our money that are going to a lot of these private institutions across many of these practice areas. So, it's kinda our data, really, and it's I don't know, there's some leverage there I think we could probably have. I'll end on two questions. One would be just around what does success look like? And I know every practice area and every, conversation and every team that you work with, every partnership that you work with in every state, there's going to be different outcomes and metrics that deem, success or not. But I guess overall, what do you look at when you look at impact measurements or results and outcomes? What does success look like, from a broad point of view, let's say? I know it's hard because each one
Yeah.
is so different, each partnership and stuff, but maybe some overall generic stuff that you look at.
Yeah. So overall, look, we have, as you can see, and you mentioned lots of projects. So we really have a portfolio approach, right, across these different practice areas. And so one of the most effective ways we think about it goes back to the predefined outcomes that you lay out at the beginning of a project. Like, what
Yeah.
do you actually want to be different in the lives of people experiencing these services? What do you want? What do you want to be better? What do you want to be improved? And for whom? And we have that hypothesis at the beginning of our projects that we work on with our governments and with our partner communities. And so we ask ourselves a couple of questions, learning questions throughout that as we measure our impact. So, did we achieve what we set out to do? Are the people the program that is intended to serve accessing the support that we set out to give in a way that is different and improved from before? And we also ask, it's really important for us as a learning organization to ask, are there areas where we've fallen short or where we haven't achieved or haven't incentivized improvements in the way that we would have thought? What are those and what is the overall impact that those shortcomings had on success? And so we do a lot of internal work around looking across our portfolio and the impact metrics, where our North Star is always around, are we achieving measurable improved outcomes for for people in our communities, no matter their race, background, or circumstance. So it's like, are people's lives actually getting better from our projects? If so, how? If not, why not?
Yeah.
But in addition to our own internal evaluation, we believe it's really important to engage with external evaluators as well. And so we bring in, most recently, for example, Rand Corporation came in and evaluated some of our California behavioral health work, innovation work.
Hmm.
And we think it's important, not so much for third sector, yes, but for our government to
Yeah.
also, and us as taxpayers, right, to see that when government innovates and focuses on responsive services, what happens. And in this case of the RAND study, they discovered that participants in the behavioral health program experienced reduced psychiatric inpatient admissions, increased stable housing,
Hmm.
and decreased judicial system involvement. So you can even see there around, like, with that, because a behavioral health
Yeah.
project,
It's the
that the outcomes,
triple crown of
yeah,
outcome right there.
yeah, the outcomes evaluated were not just behavioral health outcomes, it was also housing and judicial systems.
Right.
So that is how we really seek to operationalize the change
Yeah.
that we want our government to seek, which is to honestly focus on outcomes and responsive services for people, as opposed to focus on service delivery in individual silos.
Okay. I promise. Two more. One more question, and then the final one. One would be I usually talk to like founders and CEOs on this podcast from the business side and how the business world is really, looking at ways they could participate in a lot of these areas and improving and well through for-profit entities, let's say, which I really find very, very powerful. What is your relationship with sort of the business world been? Does third sector talk to people in the business community, maybe about their issues or what they can provide that can also be helpful to their local government, local nonprofit services. I guess how have you seen the business world play a role in this sort of ecosystem that their third sector plays in?
I love that question because the truth is, we can't, these are gnarly social
Hmm.
problems, and we cannot improve our communities without collaboration across business, government, and our nonprofits. And so we found the business community be a tremendous partner in a number of ways. So, first, I've talked a lot about incentives, right?
Yeah.
And incentivizing government to change oftentimes takes a variety of stakeholders in the community coming together to say, hey, we've noticed that we're spending a lot of money on homelessness and things are not getting better. We, the
Yeah.
business community, are with you, government, on trying something new, looking at data, like how can we help, right? Like, is it
Yeah.
you need to look at your data better to understand the problem? We've had great business partners provide in kind and also just education and some expertise to help government build the skill sets to analyze data more consistently to get to a different solution. In many cases, these programs cost money. And if, government's taking a risk to do something different with their homeless funds, the business
Yeah.
community can help by matching that, by being supportive of that publicly, right?
Yeah.
Everyone loves to do the tough headline, right, on our government partners, but business can really come in and help government stay the course. And then I think so whether it's with expertise, whether it's with talent, whether it's with funding, but I think what's also interesting about the business community is that businesses make oftentimes a long-term commitment to communities that they're in.
Yeah. Yeah.
Government also has a long-term commitment to communities and has elections, right? That happen every few years. And so you
Sure.
may have some folks who have different priorities, right? That come in with government. But what I think the business community has such an opportunity to do is be that continuous thread around, hey, no, we actually have a challenge in your community, and that's addressing homelessness. And we are committed
Yeah.
through different mayors, through different agencies,
Right.
like we are here. And we're here
Yep.
to provide consistent expertise to make sure you all have the data you need to be responsive. We're here to invest in support the nonprofit ecosystem. And we're here to partner with you all as government and nonprofit in making sure that all of our resources are in service of improving outcomes and in this, improving stable housing, improving connections to behavioral health. And so I think that the business community has played a tremendous role in the communities that we support and can continue to be, I think, a consistent stabilizing, a consistent focus on outcomes in addition to providing some funding and expertise for governments to help really make those improvements real in communities.
Last question I have is just a little bit about the future, and you and the team have been at it, for a while and, but over the next, let's say 3 to 5 years, what are some of the goals and successes you and the team would like to achieve?
I love this opportunity to think a little bigger. So I would say at the macro level, what we're trying to do is really about culture change within government. We are trying to
Yeah.
shift our big government systems from thinking about a compliance orientation, which is like, okay, I get taxpayer dollars, I put them out on the street services, they write a report, and then we just do it again every year. So we're trying to shift from a compliance orientation to an outcomes orientation. And that is just as much about culture as it is about increasing data capacity or changing how they engage with their stakeholders. But it's really about helping our civil servants, our government, and our elected officials see that response services best meet the needs of the community. And they will also go a long way towards building trust in our systems
Yeah.
and structures, then making it possible to really make our communities more vibrant and healthy. So, and say over the next 5 years, we are very focused on how do we build the case through our projects that shifting from a compliance orientation to an outcomes one is the way to go. And how do we give our governments a clear path to do that? And so I think a couple of very specific ways over the next 5 years will be investing in that culture shift is doubling down on our stakeholder engagement strategies and impact measurement strategies, making them more clear for how governments can bring in stakeholders to get to those better outcomes, to understand the data they need, how they can build those systems to make sure that they're learning and improving along the way. The cross agency collaboration. So I talked a lot about how important
Yeah.
that is. Really, whether that's, you know, not just with data sharing, but data sharing and program implementation to show that better outcomes happen when agencies focus on the people that they're trying to serve versus the program that they are,
Yeah.
tasked with delivering. And then third, actively building the skill set of the civil service workforce. So we have a particular skill set at third sector. Our goal is that outcomes focused skills and priorities are just it's just how our government works and it's how people do their jobs. And we have a pretty incredible moment in public service history with millions of folks retiring and a real need to hire a lot more in the civil service. And that's, I think, just a tremendous opportunity that we're excited to help our government agencies think differently about who needs to be in public service, what skills do they need in order
Hmm.
to deliver more responsive services and better outcomes for our communities. So that's what we'll be focused on. 5 year model.
Well, thank you so much, Caroline, for taking the time. This was an amazing conversation. And I know this work is difficult, and I think it's the toughest thing about it is that you have to be patient. Working with these entities is difficult, and it takes a lot of patience and time and effort. But it's some of the most difficult things to try to solve for. A little bit of change, if we just have it, go up in 10% outcomes, like, that's a really, really, large percentage, for a lot of these big, big issues. The smallest, um, positive outcome, and innovation can make a huge trickle down effect. So, like, it's cool to hear that there's a lot of this cool work being done in some of the hardest areas. So, best of luck to you and the team for the next decade to come. Thanks for taking the time.
Thanks so much, Grant. Pleasure to be here.